want to take a moment and talk about abdominal adhesions. I just wrote 2 articles on abdominal adhesions, and you can check them out on my Alignment Monkey blog. But I thought it'd be easy to explain a certain concept through the video format. So I wanted to talk about how severe abdominal adhesions can change your posture or how you move. So sometimes I'll get clients that come in to see me and they're having bloating, digestive issues, pain in the belly, back pain, and they're sitting in a particular way, or once again the table they're sitting in a particular way. So for instance, they may be kind of curled up and off to the side, or if they're on the table they're kind of curled around one side. That's a good indication where the restriction may be. And so what they're doing is putting slack in the tissues to take away some of the pain. And so this may be helpful to them in the moment, but it can cause other patterns, as you can imagine, to emerge in your posture and muscles and viscera, and your viscera may not function as well in that position. And so that's where abdominal therapy can really help to release those restrictions. And in a gentle way, working with the body, because if you have abdominal restrictions around the viscera, you don't want to go in there and just pull them apart, because that creates wounding and more adhesions will form in response to that. So my approach is working with the tissues gently, allowing the body to respond with its own intelligence. And I also instruct people on the breath work, because if you're breathing in a circumference, you're naturally massaging the viscera with every breath. But oftentimes when there's pain or dysfunction, we don't want to go there, and so we hold back from breathing in that area. We restrict our breath. We don't even want to go into the belly, because sometimes it hurts at first to breathe there after a trauma, but our body needs our loving presence there, and the breath is a great way to do that. Because how many times a day do you breathe? Maybe 30,000 times in a day. So every time you're taking a nice full, not forceful, but just a nice gentle breath, you're massaging the organs with every single breath and giving them a chance to work through those little restrictions, so that they don't form into larger ones. And so, for instance, back to the adhesions and hugging around the adhesions, say you have an adhesion down here. You can imagine by the lines in my shirt how it could be pulling you in one direction, and also causing neck and shoulder pain, back pain. I've also seen strong restrictions around surgical scars in the lower belly. And so if you gather up your clothes in the front, and the clothes represent the fascia, you can imagine how it might be more difficult to stand up straight because you have that constant pull downward. So that's just a little review on the concept of how the body can hug adhesions. And those are extreme cases, because there's all kinds of little adhesions that there's tiny little hugs in there that maybe you can't even see visually. And so check out the blog post on the Alignment Monkey blog and on adhesions to get a better understanding of my approach and how adhesions can affect the whole body.